Commissioner, if you may be muted. We haven't heard you yet.
Thank you. I'm sorry, I couldn't hear you either. I apologize. Good morning.
No problem. Good morning.
Thank
And
you.
the,
Can you
the
hear me
floor is,
now?
yes, ma'am, we hear you, and the floor is yours.
Excellent. Thank you so much. Thank you, Chairman Tillery, Chairman England, and all the members who are here this morning. I appreciate the opportunity to discuss the budget for the Georgia Department of Behavioral Health and Developmental Disabilities. It's great to be with you in the way that we are together in 2021. And just as we get started, I do want to offer a note of gratitude, first to both of you who I've spoken with during the pandemic, and also really to members and the House and Senate budget offices and all of the staff who have been working so tirelessly. Of course, I know about my staff, but really the cooperation and the collaboration has only been possible because of the incredible hard work across the board. So I want to thank your teams and of course, Governor Kemp and his team. The back and forth required and the conversation with our partners at OPB has been very robust, and we have really felt supported throughout this really challenging time. The virtual environment certainly has brought both opportunities and challenges, but really we sit today in gratitude for the partnership that we feel with all of our partners across the state. So really want to start with that note. Okay, with that, next slide, please. Okay, and I think we can go to the first slide. Okay, just wanted to share with you all what I plan to cover in our conversation this morning. I do plan to give you all an agency overview, remind you of what DBHDD does and who we serve. I also want to provide an update on the ADA settlement and of course on the impact of COVID-19. I will provide a budget summary and then move into the governor's budget report, and then also touch on our capital budget, and hope we'll have the opportunity to talk about future opportunities and challenges. So that's the plan for my presentation. Next slide, please. Okay, so this is a very simple description of our agency overview. And I'm actually, with your permission, going to spend a little more time than I normally do in just describing very specifically who we are and who we serve. One of the reasons I want to do this is in acknowledgement of new members to the General Assembly. I also recognize there's been so much increased interest in mental health and behavioral health and on the impact of COVID for people with disabilities. So I want to make sure we're being very clear about who we are and what we do with your support. So very critical to inform you that DBHDD serves as the public safety net in Georgia. And we deliver services for individuals with mental illness, substance use disorders, and intellectual and developmental disabilities. And I'm going to take a moment and describe each of those areas because it's complex, but we've learned so much in past decades. So want to make sure people understand the nuances in each of these areas. So when I use the term mental illness, what I'm talking about there are individuals whose diseases and illness involve conditions that impact their thinking, their emotion, and their behavior. And it occurs for them to a degree that it impacts their functioning in school or at work or at home or at life in the community. So just to be clear, those are illnesses like depression, like anxiety, schizophrenia, or post-traumatic stress disorder. All of those are examples of mental illness. When I use the term substance use disorder, what I'm talking about there is individuals who have a recurrent use of alcohol or drugs, whether they're legal or not. And that use of those substances, again, impacts their ability to function in work and in life. And then finally, individuals with intellectual and developmental disabilities refer to, and those are actually two different disability areas. So when I use the term intellectual disabilities, we're talking about individuals who, from before they were age 18, have challenges with their mental capacity and their ability to partake in daily activities of living. For people with developmental disabilities, those might be intellectual disabilities. They might also include physical disabilities, which are chronic and enduring. And in all of those cases, they might impact an individual's ability to learn or use language or participate in social interactions. So understanding all of those disabilities is important because of the nuances between them and because the services that provide relief for those individuals are financed differently and they're provided differently across our vast network. So really wanted to spend a little time and make sure that I describe those terms. So there's one other term that I'll use again, just to be as clear as we can and not use acronyms. The term behavioral health is a term that's used across the country when we're talking about both mental illness and substance use together. So sometimes those are called co-occurring disorders if they appear in an individual, but together when we reference behavioral health, we mean together mental illness and substance use. Okay, so that's just an explanation of the individuals and the diseases and challenges that they might be facing. For DBHDD, to be clear, our priority population is the individuals who are most in need and then who are uninsured, underinsured, or who are receiving public benefits such as Medicaid. Very important to understand that for all of those diseases I mentioned, they might be less severe or more severe. Our priority population is for the individuals who are most in need. So just to give you a sense of the scope of individuals facing these challenges at the highest level of need in the state, in fiscal year 2020, DBHDD served over 212,000 unique individuals in these different disability areas. And how do we do that? We do it through our network of 5 state hospitals around the state, and we have a network of over 700 community-based providers. Some of those are small, might be an individual group home. Some of those are large. It could be a day services program or an outpatient clinic where hundreds of people are served. So again, just a snapshot of the complexity of our service delivery system and the people that we serve. And one of the reasons it's just important to describe all of this is to really understand this. These conditions are treatable. And when we can identify individuals with these conditions and provide appropriate resources and supports and treatment, these individuals are able to thrive in the community. We do believe that independence and recovery are possible, and that is the work of our department and our contracted providers. Next slide. Okay, so what I'm going to do quickly here is provide you 2 different snapshots of DBHDD's budget. And the reason for doing this is not at all to absorb these many numbers that are here on the page, but just to show you 2 important things. First is that we're dividing here, we're showing you the state and the federal funds, which support the work that we do. So you can see that division there. More importantly on this slide, we wanted to show you all the different program areas within our service delivery system. So you see how it's divided by program area. So adult addictive. So that means the funds we're using to support adults with substance use disorders. As you go down in each of those program areas, that C&A, that stands for child and adolescent. And again, you'll see a repeat of some of the same program areas, but it's a different program for different age groups. So wanted you to see that we're serving individuals across the lifespan. And I know some of you have interest in particular areas of our program. So I wanted you to see that slice of the budget. Next slide, please. Okay, on this slice of the budget, again, same budget. This is our FY 2021 appropriation. You see our total, the DBHDD total amount. You can see it over there on the right. It might be buried, but that 1.3 billion Again, we're showing you this distinction between state funding and federal funding, but now we've simplified all those different program areas and we've entitled them either community or hospital. And this is a really important distinction. We have our 5 state hospitals, but over the last decade, we've made really important strides in building up our community services. I also wanted to show you our administration line. It's really important to DBHDD. We embrace the call for lean government. Our administration of these programs and services is a really limited portion of our budget, around 3%, as you can see there. So again, just a big snapshot of who we are and what we do in service of our individuals. Next slide, please. Okay, so 2 really important drivers of our work in the past year and always. So I want to talk a little bit about the impact on our operations. First, for the ADA settlement agreement, and then COVID-19. So next slide, please. All right, we'll talk about the ADA settlement agreement extension. So again, a little bit of table setting here. Just to clarify, the ADA stands for the Americans with Disabilities Act. And the state is in a settlement agreement with the United States Department of Justice. As you can see here, the beginning of that settlement agreement was October 2010. So what happened in our state was that in around 2009, it was alleged that the state had an over-reliance on institutional care, basically saying that people were using our hospitals because we did not have enough community-based services. And the allegation was that was true for people both with mental illness, as I've described, or people with intellectual and developmental disabilities. The state acknowledged that we had work to do, and that's when we signed the settlement agreement in 2010. Since that time, we have had a dramatic buildup of community-based services. You all have been incredibly generous and committed in your support for waivers and crisis services and a complete and full continuum of service for people at the highest level of need. What this allowed us to do was close hospitals and really have a robust continuum in the community. I do want to make a note that at the time, before the time that we signed the settlement agreement, we acknowledged that we would no longer allow children and youth to be served in our state hospitals for these conditions. And in addition, we also said individuals with intellectual and developmental disabilities should no longer be served in the hospital. So since that time, October 2010, we have really had a dramatic pivot to all the services that really allow people to live a life in the community. So year over year, the state has been making investments. Our continuum has become far more robust. And we got back to the table with the Department of Justice in 2016. At that time, they acknowledged the remarkable progress that Georgia had made, but they acknowledged a few areas where they did not believe that we had evidence of compliance. So you see in bullet number 2, the articulation of the small handful of important things that we continue to work on and the feds continue to monitor us on. That is continuing the use of now and comp waiver services. So let me explain a note here. Waivers are our federal state partnership that allow individuals, they waive using the institution to live in the community. And you all have supported the investment in waivers, 2 waiver programs for people with intellectual and developmental disabilities, allow us to move people either from hospital settings or from a planning list that we have where we identify people with needs and we move them into community-based settings. The federal government continues to challenge us to expand our services and our waiver availability in the community. Once those individuals are in the community, and many of these are individuals with very complex health needs, our oversight and our surveillance of those individuals, the feds continue to monitor all our processes for how we do that, how we identify and respond in real time to the over 13,000 individuals that are living in community settings receiving a waiver. In addition, we've made really significant contributions to our crisis system. What we find is that system is still challenged by ongoing demand. So, and for individuals who have special needs that can't always be met even in a traditional crisis setting. So we continue to expand and enhance our crisis services. And then finally, the final element that is under the scrutiny of the Department of Justice is our Georgia Housing Voucher Program. This is specifically a unique and innovative and recognized as, we are recognized as a leader in the country in our housing voucher program, which allows individuals with serious mental illness to live in an independent arrangement. And what we're providing is the supports and services that allow them to assist them with their functioning and their ability to live independently. That voucher program is very successful. We need to keep building the services and supports that allow people to stay in the community. So the status update I can give you quickly today, we continue to make progress in each of these areas. We collect extensive evidence of our progress. Given the change in administration in Washington, we anticipate that in the next few months, we may have a better eye towards what a new Department of Justice plans to do regarding this settlement agreement. We're really proud of the progress that we've made. Next slide, please. Okay, here's my best picture of the evidence of the progress that we've made. So again, this is another snapshot of our budget. The purpose for showing you this is not to have you track those individual numbers. I know the writing's small. I want you to know that the yellow line is community and the red line is hospital. And the starting point at this slide is 2010. And the high point, the end point of the chart here is 2021. What this shows is the state of Georgia meeting the intent of the settlement agreement, right? The intent was build up your community services. While at the same time, and I really do want to know this, it's critical that we still maintain hospital quality and safety. So you see generally a solid line along the bottom demonstrating our commitment to high quality hospital care, but a real ramp up of what's available in the community for people with all the disability areas that we serve. Thank you. Next slide. Okay, so now I want to take some time and talk a little bit about the impact of COVID-19 on our system as a whole. And it is really important, I think, to state right at the outset, there is no aspect of health and human services that has been untouched by the pandemic. Very specifically, for DBHDD and all of the disability areas, the individuals we serve, the providers who serve them, the staff, and really the network that represents the total capacity. Every impact of our service delivery system has been dramatically changed very rapidly as a result of COVID. It has changed the way people receive their services and the way providers deliver these services. And I want to remind you about that provider network that we have, those 700 providers that I mentioned. All around the state, in every corner of the state, we have providers endeavoring to serve individuals in our disability areas. All of those providers, large and small, are business owners. They are trying to maintain a business and they're in the business of service delivery. Many of them are small business providers. So the challenges you heard across the board for small businesses throughout the pandemic, those were the same challenges that our provider network experienced. Really important to understand that. So when I talk about what happened for the individuals we serve and for our providers, I think maybe it would be helpful for you to think about your own healthcare experience during the pandemic as I think about mine, because many things probably changed in what you could do, how you might access services. So really easy examples are you might have had the opportunity to pivot to telehealth. You might have had a doctor or a provider that had the capacity to do that. That was really a big part of our network's pivot as well, very rapidly. Folks were tooled to do that, but not quite ready to do that at full full speed for all the people that they serve, but that's what they really navigated the ability to do, and they needed support in order to do that. For many of us, we also delayed care that we needed. That was another big challenge facing the people that we serve. And I think you heard when I was talking in that first slide, we're serving the most in need individuals that have very complex illnesses and disorders that involve, for people with mental illness, their understanding of the world. And so the pandemic was a really challenging time for people with illnesses and for people with disabilities. So I really just want to acknowledge the challenges. Very critically, we had some important areas of our work that were very specifically impacted. And I really want to just describe those a little bit so y'all understand what the impact was like operationally. So our crisis capacity. In Georgia, we have a very robust crisis continuum. We have a 24/7 GCAL, that's our call-in crisis line, 24/7. That stayed in existence throughout the pandemic. And we have mobile crisis. Those are literally what you think. They're mobile teams that can go out in the community. Obviously, they had to rethink their ability to go to a home or to be present physically. We have crisis units where individuals who are in psychiatric crisis can be dropped off to be stabilized for us to understand what their needs are. Across that crisis system, the ability to travel freely and for staff to stay healthy was very compromised. The ability to access PPE testing and keep all of our staff safe while addressing the needs of the safety net individuals was really critical for us. Group services is another important element of our service delivery system. So many of the people that we serve, whether they have mental illness or substance use disorder or intellectual and developmental disabilities, their evidence-based treatment occurs in a group setting. As soon as the pandemic hit, not only sometimes could people not get individual in-person services, there certainly was not an ability to receive group services. So the individuals were compromised, but really importantly, the staff and the providers who served them, they couldn't provide those group services, so their business is compromised. So our work was to say, what can we do to support them? Because that third bullet is really critical. The provider network that we have are individuals and businesses and organizations that are deeply committed to the people that we serve. The stability of that network is vital to DBHDD, and the safety net is vital to the state. So knowing that there will be an end to the pandemic, but saying, how can we assure that these providers will be there as folks come back into doing in-person services? So really thinking about ways that we might be able to address the needs of the providers really became an important priority for us. I want to spend a minute to also make sure I've mentioned our 5 state hospitals at DBHDD, and I really want to stress the importance of the staffing challenges that we experienced. Right at the moment COVID hit, we experienced what hospitals all around the state found, which was that it was very easy for COVID to come into your hospital, and it was not easy to manage it once it was in the hospital. How did it come in? It might have been a patient. Also, our staffs are people who live in the local community. So when a local community became infected, unbeknownst sometimes to a staff person, when they weren't yet symptomatic, they came in to our hospital. And what we found very quickly was that we had to make dramatic changes to make sure that we could do quarantine and isolation, send staff home if it was not appropriate to work, and most importantly, protect the patients that we serve. This was a Herculean effort. And when we acknowledge healthcare heroes, I really just want to say we had many of those at our state employees in our state hospitals. So next slide. Okay, so what I want to tell you about really is the solutions, because many activities kicked into gear. And I'm so proud of the partnerships and the work that enabled us to keep doing what is our #1 priority, keep the doors of the safety net open. So what you see in this first item is a number of descriptions of the activities that we had to very quickly work on in order to keep the doors open to service delivery. That meant ensuring that crisis services were still accessible and available. In many cases, we had to very quickly modify service requirements, give us flexibility to allow and to provide fiscal support to providers who were saying, we want to serve, but we can't. How do we stay in business? So we have to acknowledge the support from the federal government. I want to acknowledge our partners at DCH. And I really want to thank the governor's office and the support, very specifically Ryan Loke, Commissioner Berry at DCH, when they were looking at the hospital needs across the state. They recognized the DBHDD hospitals and our state employees and the challenges that we were having. And we were immediately included in the Jackson Healthcare staff augmentation. I don't know how to tell you how vital this was as a lifeline for the continuation of the safety net. These activities are current. All of them are very real and active right now, enabling individuals to still access services, even if it's in a different way, and really to ensure a partnership with our providers. This is so critical, and this is in process right now, all of these activities. So now I want to describe a little bit about the funding mechanisms at work here. So you see item number 2, the state match. So and the requirements, what happened with FMAP to enable all this flexibility that we had. So I think most folks are familiar with the fact that Medicaid is a joint federal and state program. Every year there's something called the FMAP. That's our particular state's allocation for how much Georgia has to pay into this partnership with the feds. Generally, the state portion is about 33%. What happened as a result of the public health emergency is that the feds gave a really, really vital lifeline to the states. And it's called an enhanced FMAP. What that allowed us to do was reduce the amount of match that the state pays so that we had extra state dollars to do all the things you see there in item number 1. These enhanced FMAP dollars are time-limited dollars to help us survive the pandemic. And they really, really have been vital to our ability to proceed. So really can't emphasize enough how important they've been. And I'm taking the time to do this because it's an important part of our budget discussion. So next slide, please. Okay, so quick snapshot, budget summary here. Next slide. Just a reminder of the fiscal year 2021 and the budget reductions that DBHDD experienced in the amount 10%, just like everyone else, which was 123 million. But I also want you to note the enhancements there because as we did these strategic reductions, there was also recognition that there were some enhancements necessary, particularly in areas around our now and comp waivers and also really especially crisis services. This remains really, really vital to the well-being of individuals in the state. So you see there the net change to DBHDD's budget. I want to assure you what you see there, our goals remain the same. Whether it's the pandemic or not, we still have a strong commitment to provide services and support to individuals in communities and in our hospitals, and to do so in the most efficient and effective way that we can. Next slide, please. Okay, so now to our statewide adjustments and our agency priorities. Next slide, we'll show you the numbers here. Okay, so what you can see is that first line item, TRS adjustments, many of you are familiar, that's teacher retirement system. Actually, that small line item just references the fact that in our partnership with Augusta University and in our some of our crisis units, we actually do have teachers as part of our network. So that's the reference there. Item number 2, that annual FMAP rate change. So that's the regular FMAP. That's the one you see in our budget every year. That's a budget neutral item. It's either up and down to help keep that budget neutral. You see that item in the 22 budget there. All these next 4 items that you see all relate to the enhanced FMAP. that I was talking about, these dollars that helped us to survive COVID. So I'll kind of group them together, and really all those services you heard about, the pivot to telehealth, the ability to give providers retainers and to continue to do all kinds of innovative services, support individuals and families to stay in their home if that's where they needed to be. That's what the utilized number 3, those enhanced FMAP for services, they're for developmental disabilities and for mental health. And the backfill you see in item number 6, same thing in last year's budget, the budget reduction there. So all of those, we believe these funds are critical for us to continue to navigate the pandemic that is very real across our hospitals and communities. Item number 4, I'll take a minute to explain. I see we've got some acronyms in there. So again, it's using that enhanced FMAP to implement a feasibility study. OPB has charged us with looking a little more closely at something that we call an IDD BHC. So remember, IDD is individuals with intellectual and developmental disabilities. A BHCC is part of our crisis continuum, Behavioral Health Crisis Center. And what those are serving individuals with mental illness and substance use disorders. What we know is individuals with intellectual and developmental disabilities also find themselves in behavioral crises. We'd like to be the first state that stands up a unique center that would be specifically devoted to this form of treatment. So OPB has asked us to look a little more closely and refine our plans for what that would look like. And item number 5, again, the enhanced FMAP, our acronyms there, Southwest State Hospital and Northwest Georgia Regional Hospital. I think I mentioned previously, we have 5 state hospitals. We have 2 that we closed. DBHDD still maintains those campuses. And the cost to maintain those campuses so that they can be considered for sale by state properties, it requires us to maintain those campuses. So the funds there, we're going to use the enhanced FMAP in order to make sure we maintain those campuses so they can be considered for purchase by private or other entities. So that's our total there. Let me move to the next slide, please. Okay, and then here's our budget request for 22. 4 items, pretty straightforward. Many of you have seen some of these before. That first line item, the now and comp waivers, these are what allow us to move individuals either from a hospital or from our planning list into community-based settings. So we're seeking 100 new waivers in 22 at a cost of, as you see there, about $2 million. The second item, annualized funding for a new 40-bed forensic unit. This is in our hospital, West Central Georgia Regional in Columbus. We have no plans to expand our hospitals except for one area where we serve forensic individuals. Those are individuals who are involved in the court system. They come to us sometimes for a period of time so that they can receive treatment and be restored to competency so they can stand trial for the crime that they have may have committed. So we're building a new unit. You all had provided operational funds to begin standing that up, and now we're analyzing that in the hopes of having that open in this fiscal year. The next item, I mentioned the Georgia Housing Voucher Program. So you all have provided funds for 2,000 individuals to be in those housing vouchers. We're not at 2,000 individuals. So what we're going to do while we continue to build, the numbers are increasing, but is to use those funds for the services and supports that enable people to live successfully in those independent settings. And then that final item are reference for staff, corrective action plan specialists. So again, this is about our partnership with our providers. Our providers all around the state serve tens of thousands of people. In that, when incidents occur of any kind, those are reported to the state, and we investigate those. If we find that a provider has deficiencies, we want to do everything we can in order to help that provider succeed in delivering services. That's what these corrective action plan specialists do. And so we're seeking funds for additional individuals to do that work. Okay, next slide. Our capital budget request for 22, please, next slide. Okay, two items here for bond requests. And really just want to make mention, again, this is about our 5 state hospitals, but really want to make the picture clear for those of you who haven't seen, our hospitals are actually campuses. Over the course of those 5 hospitals, we actually have about 470 buildings, many of which are old and in need of expected repair, some of which you see in terms of hospital sustainment bonds that might be for fixing lighting or parking lot, and where we're referencing the 20-year bonds for major renovations, it could be that a hospital needs a new roof. So again, the quality and safety of our hospitals is vital. So we make these capital requests to preserve those facilities. Next slide. Okay, just a quick note of some of the critical challenges that we see. Some of you are familiar with all of these. Next slide, please. I'll just touch on a few of these. I want to make sure we have time to address your questions. So number one, again, you've heard repeatedly, and I know you all remain concerned about when individuals experience crisis. I want to make sure that you know that Georgia, through the result of your investments over many years, Georgia has what's nationally recognized as one of the most comprehensive and robust crisis systems. But we still need to continue to build and enhance and use our learnings to continue to make it possible for people who are in crisis to receive the services and supports that they need. Of course, we want to continue the ongoing implementation of our ADA settlement services and continue to refine those and demonstrate and our evidence of the progress that we've made. I've mentioned the planning list. You all have been familiar with this. What you know is we have about 7,000 individuals with intellectual and developmental disabilities who are on our planning list that we seek to serve as we are appropriated funds to do so. I want to make just a quick comment about item number 4 in community behavioral health. We use the term core outpatient because many of you have really begun to understand our system, and you've asked the really critical question. Is there anything we could do to prevent so much need for crisis service? And the answer is yes. We need to continue to build what we call basic outpatient services so that before individuals get into crisis, they have easy access into the level and type of service that we need. So we'll continue to promote and seek ways to make it easier for people to access what they need in communities all around the state. I want to say a word about addictive disease and capacity needs there. And I do want to acknowledge the federal partnership, as many of you are well aware. For the last 3 years, we've received significant enhancements to our addictive disease service delivery system by virtue of the federal grants for opioid use disorder, which we've really expanded what we're able to do in communities all around the state, and it's been vital. And then, of course, we seek to improve our capacity for forensic services. Again, individuals who are involved with local law enforcement and the criminal justice system, we want to be sure we're partnering with all the elements of service delivery that really assist people in moving through a continuum of care. And overall, what I hope you see here is that the investments we've made are working, but we're going to continue to need to build and enhance what we do, really to address what continues to be increased demand all around the state. So let me pause. That's my final slide. And I know you may have questions. That's been a mouthful. Again, let me thank you for the opportunity. And then let me also just, as we move to questions, I want to let you know I have some teammates on the line and I just want to introduce them. So Ashley Fielding is on the line representing DBHDD. She's with us now as our Assistant Commissioner. And then I also have with me Mary Price, who is DBHDD's Chief Financial Officer, and Chris Hamilton, who's our budget director at DBHDD. So as you have questions, one of us will seek to be as responsive as we can. So Chairman Tillery, Chairman England, I turn it back to you.
Thank you, Commissioner. You have a couple of questions. Senator Burke, Chairman Burke.
Thank you, Mr. Chairman, and with your permission, I may go a little long. I'm just going to warn you. You cut me off when you need to. Commissioner, first of all, thank you for the work you and your team are doing. The times we're living in is unprecedented, and the challenges on the mental health side of the healthcare continuum has increased exponentially because of that, and you know your team has recognized that, in addition to all the other burdens you bear, whether it's addictive diseases or the developmentally disabled that are always among us. You've been amazing, actually, in the capacity that y'all shown and the flexibility. A couple of years ago, we passed the House Bill 186. That part of it was the Health Act that developed the Office of Health Strategy and Innovation, and I want to congratulate the governor on picking a great young individual, Ryan Loke, to be in that position. And part of that charge in that act was to kind of evaluate the health agencies in the state and how they work together. And you know, even before he's hardly been settled in that position, a lot of the need for that act has disappeared because of the work that you and Commissioner Berry and Commissioner Crittenden and Director Rollins and obviously Commissioner Toomey, y'all are working together almost daily on these challenges, and I just want to make sure that I publicly thank you for and the rest of those health-related commissioners for the work that they're doing. And then obviously, you know, the folks in the education system that again, these youth that have these mental health challenges are part of our education system, and that's very challenging for us to deal with. Getting around to the point I'm making, you know, our facility in Southwest Georgia continues to have the mental health patients in our emergency room, and your group does a great job of helping us find placement. Unfortunately, you know, we're asking for help frequently for patients that aren't under your purview, those on Medicaid and those on commercial insurance, or they're part of the problem, but they're not your charge. But that being said, you guys are the experts, and so I'm just asking for, and I know I'll get it, cooperation, because that's still a huge issue, and we've got to figure out how to handle those folks that are continuing, especially in this COVID era, to take up space in our emergency rooms when we really don't have space. And it's going to take a partnership with all hands on deck, but I don't want anybody to think that I'm blaming you, because again, I think y'all's agency has done a lot of work in the last several years to help with that problem, and it is definitely better. But part of the issue is, even with the commercial patients, those with behavioral or mental health problems are super expensive, and the state could do a lot towards helping our state budget by improving those access points and taking care of those patients. And again, I just want to challenge your agency to help us over the next year or two to figure out how we can integrate holistically the mental health aspect of patient care in with our primary care, because I don't think we're going to be able to solve our budget crisis until we get a handle on that. So thank you.
Commissioner, if you want to respond.
So if I might respond just quickly, just first to say thank you for the kind words. You're right that the relationship between commissioners and partners here is forged in steel as a result of the pandemic. And you're also right that Ryan Loke has been an incredible ally in reinforcing the connectivity between the agencies. In the end, we're all serving people, right? And what we want is our Georgians to get the quickest access to what they need. You raise a very complex issue. Thank you for acknowledging our role as the public safety net, and you give us state dollars to serve individuals who are uninsured, first and foremost. We will continue to do that, but we accept the challenge to say, how can we work more closely with our private partners? We do find in hundreds of crisis cases a year that we are on the phone with our private partners, really working hard to do whatever is possible. And I should mention, we have field offices all around the state. You reference, I know you're close with our field office personnel. They're on your speed dial, as they should be. Our department is positioned to help, and we want to meet folks at the highest level of need. So we'll continue, and it's really my hope and my belief that the governor's Behavioral Health Reform and Innovation Commission was designed to do exactly this. This wasn't just about DBHDD, it really was about the needs for the state as a whole. So we're excited to see where that commission can lead recommendations and possibilities for the state. So thank you.
Thank you, Commissioner. Chairwoman Oliver.
Thank you, Mr. Chair. One of our members is following your instructions about sending a question to me, and it's a very good question. Are there going to be any cuts in the peer-led substance abuse recovery program? That's a very popular program with a number of our members.
Yeah, thank you. Thanks so much for the question. We share your passion about peers. So very clearly, no cuts to peer services. As you can see, we only have enhancements in the budget this year. And I appreciate you mentioning peers, because I want to take the opportunity to shout out our peer workforce. So peers are individuals with lived experience. They are working all around our state tirelessly to be a connection for people with mental illness and substance use disorders. They ramped up during the pandemic in ways that are really incredible. They are a vital part of our workforce. And really, I think the challenges ahead is how to have more of them, how to infuse them more into the workforce and into our continuum of care. So we share our passion about Georgia as a leader in peer services, and lifting them up is what we continue to hope to do.
Chairman England.
Okay, I've got one question online, Commissioner, from Representative Carolyn Hughley, and just says, Commissioner Fitzgerald, I want to bring to your attention our interest in the Bradley Center providing added mental health services in its crisis stabilization unit in Columbus. Also, what is the status of the discussed pilot project for outpatient treatment as part of the Behavioral Health Reform and Innovation Commission?
Okay, so two questions. I want to make sure that I get to both of them. So to the first one, yes, familiar with the Bradley Center. It's one of, as I mentioned, crisis units around the state, and those are vital to the safety net. And so we hear from communities all around the state, some for whom those crisis centers are really doing just what they're intended to do, which is serve people in crisis in their community. And there are other communities that are seeking more. They would either like a unit or enhanced beds. And so we continue. One of the things I'm really proud of over the last several years, we've really have a sophisticated data collection system to understand where the greatest needs are in the state. So when we come to you seeking more support for crisis services, we do that in a reflection of what the data tells us where the needs are. So we're constantly looking at that. So I want to assure you of that. The second question, I believe the question perhaps was about assisted outpatient treatment, which I understand has been brought forward as a recommendation of the Behavioral Health commission that was referenced. So just to be clear, I'm not sure, I don't believe the report and the recommendations are finalized yet. When they are finalized, we look forward to working with the governor's office and the General Assembly to consider what are priorities out of those recommendations and what would be considered for appropriations to provide the services and supports that are perhaps recommended. So we're looking forward to the official report from the commission.
We had a message from Senator Sims, a virtual message, and she has an issue down in her district and would ask if you don't mind, please, contacting her at your earliest convenience so that she could address that with you offline. We have a question.
Thank you. I am aware, and I know our team is working with her, so we can make sure we close the loop there. Happy to do that.
Thank you. Pro Tem Miller.
Thank you, Mr. Chairman. Commissioner Fitzgerald, thank you very much for your work, and DBHDD is an important part of our safety net and lends quality of life to a whole host of Georgians. The new 988 program, the mental health crisis hotline or lifeline, I think it's called. Can you tell us a little bit about it briefly? I know you only got a moment or two. And also, what changes are you going to have to make to accommodate that? And how can we as the legislature help accommodate it? Thank you.
Yeah, so thank you so much. And thank you for your tireless advocacy for the people we serve and support. So very quickly, 988, you saw it on the slide. I'm so happy to have a chance to make mention of it. So if you didn't hear this in the national news, 988 is the number that the FCC, the Federal Communications, designated as an easy to dial 3-digit number that would give everyone an access to the National Suicide Prevention Hotline. This occurred in the summer of 2020. It was something we had advocated for a long time. So in the summer, FCC made the designation. In October, the president signed into law a bill saying that by 2022, all telecommunications companies should be prepared for phones when they dial 988 to go directly to the National Suicide Prevention Hotline. This is one of the biggest transformations in our behavioral health system that I think we're going to see. It's like 911 for behavioral health. So the good news for Georgia is that, as I referenced, we have our GCAL, our Georgia Crisis and Access Line. We have an infrastructure in place to receive emergency calls 24/7. Right now, actually, when the National Suicide Prevention Hotline gets a call from Georgia, they send it to GCAL. So we already have some of the basic infrastructure in place. So we are ahead of most states on this count. But to your point, there's going to be a really critical need for enhanced infrastructure to address what we think is going to be a significant increased volume of calls that might come to Georgia. And we want to be able to be responsive. So we look forward to working with you closely. We are in a small planning group with some national leaders that are really responding on how to build appropriately to get ready for 2022. But we look forward to keeping you updated on that and letting you know as we roll forward what some of the infrastructure needs might be. We're excited about the opportunity, but we are going to need your partnership to address it. So thank you. Thanks. I'm glad you asked.
Chairwoman Dempsey.
Yes, just real quick, thank you, of course, for everything and for this great presentation this morning. As we break into subcommittees, we'll have a little more time to discuss this. But quickly, before we walk away, I know there's been so much national data published recently about the uptick in behavioral health issues and particularly the record numbers of overdoses during the pandemic. And just I know you're seeing a lot in Georgia. If you have a quick response to what you're seeing, but also how our system is coping with these huge increases.
Thank you so much, Madam Chair. And again, thanks for the partnership and the ongoing dialogue throughout the pandemic. So I think as most folks know, it's been widely reported in the national and state media about the impact of the pandemic on mental health and substance use disorders. This is really important. And I actually want to talk about two things. One is just average folks who didn't think that they had any mental health issues, but the impact of social isolation, anxiety, job loss, all the other things that have come with the pandemic have really increased awareness for people about how important their mental health and well-being is, and really challenged to say, how do I take care of it during the pandemic? The other population of great concern to us, of course, are people already known to our system who are already challenged with mental illness and substance use disorders. You are correct. There has been an uptick in use of crisis services and in substance use disorders and emergency room visits for overdoses and increase in addiction. So a couple of things that we've done to respond. First, really proud of our team. We set up an emotional COVID line for people to call. So this is whether or not you had ever experienced any mental illness or challenges before, but you really just needed to talk with someone. We had a support line that people could call into. It relieved the pressure on GCAL and the volume of calls there, and enabled people to have a lifeline that they could call. Our peers also stood up they have a warm line that remains available throughout the pandemic for people who need to talk to someone about their concerns about their mental health and addiction challenges. We received federal grant money to identify special populations within the pandemic, people who might experience domestic violence, people at risk of suicide. So we have put a number of awareness raising and prevention activities in place in local communities to really try to reach out as best we can to folks all around the state and let them know the resources that are available. And we'll continue to do that. So I appreciate the question because it remains really current as COVID continues to really present challenges all around the state. Thank you.
Commissioner, thank you. That's all the time we have for your presentation today. We went a little over, but we definitely feel that your agency is one of those that is worth doing so. Thank you also to your crew for helping us as we've tried to address therapeutic foster care and residential psychiatric facilities over the past interim, and also helping team with us as we work to address the ADA settlement issues that I know are important to you as well. Again, thank you for your presentation today. Thank you for your team members for being present as well.
Thanks to you. We really appreciate the opportunity. Thank you.
Next, we have with us Director Farr from the Office of Planning and Budget.
Morning, Mr. Chairman. Can y'all see and hear me okay?
We got you. Go ahead.
Good. Morning, Chairman England, Chairman Tillery, and members of the committee. At times, it's hard to believe how much has changed since I did this just 12 months ago. While every year brings change, I'm not sure of a year that brought as much as 2020. Many of us have lost loved ones way too early. There are many new faces. Extra duties have been assigned at most agencies. And there seems to be a new challenge almost daily right now. All of this can seem daunting and overwhelming. However, even in the face of these challenges, I continue to be inspired and motivated by the people I get to work with during these tough times. I want to thank you, Chairman England, and Chairman Tillery, Martha Wigton, Melody Debussy, and the staff at the House and Senate budget offices. The budget report before you today would not have been possible without all of you and your team at and my team at OPB. As the pandemic began, you reached out to pledge your help. We are grateful and better from your help. When the legislative session was interrupted last spring, we all worked together very closely to pivot and quickly write a budget almost from scratch. Pretty soon after the session wrapped up in June, we were back at it, working together again on a number of projects through the summer and fall. many of which I believe are reflected in the governor's budget proposal. I believe this process has helped my team better understand certain issues, and it's invaluable for us to have the perspective of the General Assembly when we are doing our work. I also appreciate the feedback and insight that I've personally gotten from each of you this fall ahead of the governor introducing his budget, and I hope that we will continue this close working relationship between all of our teams going forward. When we did meet last spring, we were faced with an unprecedented situation with very little idea of what the longer term financial implications would be on the economy as a result of the pandemic. As Governor Kemp said on Tuesday, we made difficult but proactive decisions in June that have really positioned us well for the budgets that he presented to you this week. The original FY21 budget that the General Assembly had passed in June cut more than $1.6 billion from the base FY20 budget. This amended FY21 budget restores just over $650 million of that. And I'm so relieved that our actions in June meant that we are not having to further cut agency budgets in the final quarter of this fiscal year. Instead, we were able to restore vital funds to our K-12 and higher education systems in both the amended budget and also in the general budget. But as Chairman Hill has always reminded me, Georgia is usually last into a recession and the last out. To date, through FY21, our revenues have performed very well compared to FY20. Through last month, the Treasury reports general fund collections running 4.7% ahead of FY20 collections. However, we are only now entering tax filing season. And as Dr. Dorfman shared with you all on Tuesday, we do expect refunds to be substantially higher this year as a result of both individual job losses and corporate profit losses. As a result, we will not know where we stand for this fiscal year until the end of May. So the revenue estimate for AFY21 is still 2.5% below the actual general fund revenues we received in FY20. However, as we look ahead optimistically to a more return to normal next year as we accelerate vaccine distribution, the FY22 budget assumes a 3.7% general fund increase in revenues over the current year. This would be a growth rate more typical in an out-year budget. As the governor said, supporting our school systems, teachers, employees, and students is a priority of his administration. Therefore, of the $654 million restored in the amended FY21 budget, $647 million of that will be going directly to K-12 education. Both the amended and general budgets restore 60% of the reduction taken in the original FY21 budget for local school systems. Those restorations and the $2.1 billion local schools will receive through the Federal Education Stabilization Fund, we will be able to ensure that our schools have the resources they need to continue providing a quality education during this pandemic and will not be negatively impacted by any temporary enrollment declines that they may have experienced due to the pandemic. Chairman England, during the summer, when the governor issued his flat budget instructions to agencies, you reiterated this year wouldn't be just flat like a pancake, but flat like a crepe. And I do believe that you'll see throughout these budgets that most of our agencies are flat like a crepe. But we've had agencies find innovative ways to do more with less and to effectively manage their budgets while still meeting the mission of their agencies. So with our flat as a crepe budget, I do want to take a minute to focus on some tremendous items included in this budget that we are funding through redirected savings. Working closely with the Department of Corrections and Department of Juvenile Justice, we were able to identify $26.7 million in funds that could be redirected through more strategic position and overtime management. These budgets authorize those agencies to use those funds to provide a 10% pay increase effective April 1, which would be on average $3,500 per correctional officer, to our more than 4,600 correctional officers in recognition of the tremendous work these officers do every day and have done for the last 10 months during the pandemic in protecting the facilities in which they serve. We are also recommending $28.5 million in FMAP savings in the amended budget for DBHDD to provide additional community services for some of our most vulnerable Georgians. Those increased FMAP savings will also provide $3.5 million for the Department of Human Services that we will use to address the increase in adoption caseloads. I also want to take a moment to give you all a brief update on how the state has utilized the coronavirus relief funds, also known as CRF. As you likely are aware, last month, Congress extended the deadline for utilizing those funds until December 31st of this year. We are very appreciative of those actions as it gives Georgia greater flexibility in using those funds for ongoing critical needs as the pandemic continues. For Georgia, we tried to be cautious in allocating our funds to date to ensure that we would have sufficient resources to see us through this crisis. While other states have almost fully obligated all of the funds they have received, leaving them little flexibility to meet changing or ongoing needs for their states, Georgia has prudently taken steps to ensure our funds will last. To date, we have provided local governments with more than $365 million from the fund to assist them in covering costs they may have incurred within their local communities related to COVID-19 response. The governor has also dedicated approximately $78 million for COVID testing for staff within our long-term care facilities across the state, and he recently extended that grant deadline to continue through June in order to assist our facilities as vaccines are distributed to residents and staff. We will be using $60 million of the CRF funds to provide additional support to local school systems for expenses related to the safe reopening of schools. We have committed $350 million for medical staff augmentation to support our hospitals and nursing home facilities. We have needed additional physicians and nurses to care for their patients during this time. And we have spent more than $300 million on PPE and state agency responses. And finally, the governor has set aside $1.5 billion to date to be used towards our state's unemployment insurance trust fund. At the beginning of April last year, our UI trust fund stood at more than $2.5 billion. By August, UI claims during the spring and summer had fully depleted the trust fund. As a point of comparison, the state spent about $300 million in UI claims in the entire previous year. Since August, we have used more than $994 million from the Coronavirus Relief Fund to repay advances on the UI Trust Fund needed to continue to pay out benefits. While Congress's extension of enhanced UI benefits will provide much needed economic support to individual Georgians, as well as to our state revenues, it will continue to put heavy demands on Georgia's UI Trust Fund. In order to continue to pay out benefits, we will continue to need federal advances on the Coronavirus Relief Fund until claim levels drop to where incoming contributions from employers exceed benefits being paid out. While the federal government has provided direct financial support for pandemic needs like COVID testing, vaccine distribution, and food and housing assistance for citizens, federal stimulus bills have not directly addressed the financial impact on individual state unemployment insurance trust funds. Unless we continue to leverage the CRF to repay advances as they are incurred, the state will otherwise be forced to rely on increased UI taxes for Georgia employers to repay these federal loans while covering any interest on those loans directly through our state budget. Therefore, I believe it's imperative that we reserve as much as possible for the remaining and unobligated $440 million of coronavirus relief funds for direct state COVID-19 response efforts and to keep our UI Trust Fund balance positive. Now, with regards to OPB's budget, The only change to our budget is a small adjustment for the statewide change, the teacher retirement system for next year. And we will be able to manage that within our existing budget. Thank you for the time this morning. And at this time, I'd be happy to answer any questions you may have.
Thank you, Director Farr. Do we have any questions from members in the audience? We do not have any questions in the audience. We don't have any questions online either. Director Farr, thank you for walking through how some of the federal dollars have been spent and how they've impacted the budget that may not be reflected in the book that we have in front of us. And thank you for your presentation. We do have one question that's come up from Pro Tem Miller.
Thank you, Mr. Chairman. I'm not sure this is the appropriate place, but I was wondering about the income, the support, the continuance of the Georgia World Congress Center and how it has been hit so hard. And if we might have some comments or thoughts. I mean, I think they've 400 employees. I think they're down to about less than 100. And any thoughts, Kelly, if you don't mind?
I think a lot of our authorities have been challenged this year because of lost revenue, right? I think, Georgia World Congress Center, Ag Expo, Stone Mountain Authority, Ports Authority. I mean, they've all been hit pretty hard. And so I think it's going to take all of these folks a little bit of time to dig out of that hole. I would think as it relates to the World Congress Center specifically, I know it doesn't replace all of the big, great lost events they have, but, they are getting a little bit of money from renting it out for the COVID response. They're doing it down there. There is some money in the budget to help in the bond package to offset some maintenance expenses. And so I don't know if that answers your question, but I think a lot of the authorities are going to be challenged for a little while.
Thank you very much.
Chairman England, do we have any other questions online?
Yes, we've got one from Senator Orrock. What is the thinking on how to break the logjam at the Department of Labor for suffering Georgians with reduced income or no income due to COVID? Can we use National Guard services as is done by some other states?
I don't know. I don't know that I have an answer for that. I do know that the Department of Labor has received federal administrative funds to help undertake some of the, remarkable amount of workload they've received since the pandemic was started. I'm not aware of National Guard being used for such instances, but that's not something I'm familiar with.
Chairman England, do you have any comments?
Yes, sir. I just, Director Farr, you're very kind in your comments, and I just want to reciprocate as well. Thank you for the teamwork that we've been able to accomplish over the last 10, 11 months now since we've been in this situation we found ourselves, and kind of recalling a phone conversation that you and I and Chairman Hill had back, I guess it was in March, that the only way that we're all going to get through this is we'll go through it together. And you and your folks have been incredible, and I know our folks have done everything that they've known to do as well, and just appreciate the working relationship that we have, and the input that you've, as you mentioned a minute ago, that you've allowed us to have both the House and the Senate in the crafting of the governor's budget, and know that we're going to continue to work together as we continue to dig into the amended and getting to something that we can get to the governor's desk fairly quickly here, so that should we have to take a pause, the good news is our testing numbers are looking real good at folks coming and going here, so hopefully that does not occur. But should we have to, being able to get an amended budget done, so our state agencies, our school systems, and all those that depend on items within the state budget will know what they have to finish out this year into June. Hopefully, prayerfully, we don't wind up back here the last 2 weeks of June to finish up the budget for next fiscal year. That is not fun, especially for our colleagues in the Senate when the posture we found ourselves in was that they were the ones having to start from scratch, basically. And again, I'm just so proud at what our teams have done. Senate Budget Evaluation Office, House Budget Research Office, and the team there at OPB to get us through all of this. It has not been easy. I know you have had many sleepless nights throughout this process, and I know that you carry an awful lot of the burden yourself for people that are suffering, and I appreciate that. I know we all do. And I'll leave it at that. And Mr. Chairman, I think we may have one question in the room.
Chairman Watson.
Thank you, Mr. Chairman. Director Farr, thank you for the job you've done. Just curious, I know there's been some more funds released. Do you foresee any more COVID funds coming to help the state and the schools in the future? Do you have any of those numbers yet, or can you speak to that yet, or is what we've got and we need to be careful as we move forward?
Well, I mean, we have recently, I mean, within the last, still kind of funneling out right now, but, over Christmas time, they did pass an additional, $900 billion package. So that's where you've seen like a lot of this additional money for school systems, like there's $1.7 billion in that for school systems. There's close to $800 million in that for DPH, to help with vaccine distribution and testing and child development block grant money. So, we're still seeing some of that stuff kind of trickle out now as people peel apart what it all means. We really haven't seen a whole lot of direct state and local government support since the CARES Act over the summer. And as everybody probably knows, we can't use that to help offset any lost revenue or expenses that were contemplated in the previous budget or that were not directly related to being reimbursed for COVID expenses. I have seen, a few comments come out from President Biden and his team about their intentions of their package. I think it's in like the $1.2 billion range. I know that in that outline, I saw about $350 billion for state and local governments, as well as more money for school systems and testing response and things like that. And until that actually gets passed and we kind of see I hate using the word strings, but the obligations that it creates for the state in other ways, I really, at this point, don't know how it could or could not impact the needs for the budget right now.
Thank you, Director. You've exhausted the questions in the room. Again, thank you for the kind words you said about the Senate Budget Office as well as the House Office. I appreciate the work and the candor that you've provided throughout this process as we try to make it as seamless as possible and also include as many member comments, knowing that they represent the issues back home that matter to their constituents and all Georgians. Senator Orrick, if you can still hear me, if you have that information about National Guard folks elsewhere, please get it to me and I'll make sure I share it with the director as well. Director Farr, that's the end of the comments in the room, and thank you again for your presentation.
Thank y'all again. I really appreciate it, sincerely.
Committee members, we have now reached the end of our agenda for the 3 days of joint appropriations hearings. Let me tell you, thank you for your presentation or for being involved, both those of you who are involved here personally in the room and those who've been involved across the state. This was the first time we tried it this way, and I think that it worked incredibly well, particularly given the first time that it happened. The reason that it worked so well, though, is because of our colleagues in the House who truly bent over backwards to make sure this process was seamless, even though that was the Senate's year to host. So thank you, Chairman England. Thank you, Speaker Ralston. Thank you also to the House Media Services Office, who truly did bend over backwards to make sure that we could make this work. If the members in the room don't mind, I would like to give them a round of applause. This has gone so well, it may be something that we want to extend into times even when we do not have to do this. So be thinking about that. You may get a questionnaire that goes out later from us asking how we can do things better. Even though we think this worked pretty well, we always realize that we can do things better on our end. And as we look at doing things better for our citizens of the state, as we do every year, we need to make sure we're looking internally to make sure our processes are working as smooth as they can as well. For you as members to be able to do your jobs back home, but also so that we can make sure we're open and honest and transparent to the almost now 11 million Georgians who we all have the pleasure of representing. Thank you, Senate Budget Office, Melody, for you and your help through this process. Martha, the House Budget Office as well. And Chairman England, if you have any closing comments you'd like to make.
Sure. Thank you, Mr. Chairman. I'd like to echo the same things that Chairman Tillery just said to our friends at Senate Budget Evaluation Office. Thank you for setting the schedule and getting everybody lined up there, and to Martha and our team on our side for the work that was involved in helping there. Again, a huge hat tip to Betsy Theroux and the team at the House Media Services. I'll be honest with you, I've been scared to death for about 2 weeks knowing that this was the format we were going to be using. I am not a IT person and had no idea how in the world this was all going to work, but Betsy and her team have made this incredibly easy, almost scarily easy of how well this has worked, and we just so much appreciate the job that they've done and helping us with it all. A couple of housekeeping items for our House members. Please note that you have gotten email invites to subcommittee meetings starting today and that will be running tomorrow. It is important that those of you that are on these subcommittees, be on those Zoom. These will be virtual. Some will be hybrid, virtual, in-person type meetings as well, but it is very important, again, based on the need to get the amended budget done in case we have to hit the pause button at some point. We're on a very accelerated pace this year, more so than normal. And right now, the plan and the intention is that our subcommittees will all meet here in person on Tuesday. Some folks may do it virtually as well then too, but to vote out the final recommendations from the subcommittees on Tuesday. So it's very important that you be in attendance today and tomorrow on those hearings, because that is when the work is going to be done. Some decisions will be made, of course, as to some changes or any changes that are going to be recommended to the governor's recommendation, so that we can compile and balance in time for you all then to meet to vote those reports out on Tuesday. Mr. Chairman, that's all I've got. I appreciate everyone's attendance. We've had outstanding attendance, not only in person, but we have had incredible attendance online from our members and participation. I appreciate, again, y'all working with us as we try to figure out the chat feature and how to use that to receive questions and then ask it. And as Chairman Tillery said, I think it really surprises all how well or how smooth it seemed to have worked, at least from up here, from this vantage point. And just thank you again to everybody, and thank you to Chairman Tillery. Appreciate him and the work we've gotten to do together over the last several months, and looking forward to many years to come. Thank you.
This was our first budget hearing first full-year budget hearing, joint budget hearing without Senator Hill. And I know many of you still miss him. These probably would have run even smoother had he been here. And we all miss him, but I hope that we have done him proud by our work these past 3 days. I know we will make him proud by the work we will do over the next few weeks. as we work to make sure that those 11 million Georgians we have the pleasure of representing are represented in this budget. So thank you again for being a part of these meetings. Well, we will adjourn now. Remember, we will join back at 1 o'clock for the federal block grant hearings for FY22. Thank you again for being here, and those of you who have to be back at 1 o'clock, we'll see you at 1 o'clock.